My name is Godfrey Deje. I'm the head of the Oncology Pharmacy Unit at the Radiotherapy Center and a specialist oncology pharmacist.
I am Agatha Deus Sunyameshe, currently the unit head of the Korle Bu Manufacturing Unit.
My name is Justice Dupe, and I head the Obs and Gynae Pharmacy. I'm a pharmacist, consultant pharmacist in the Korle Bu Teaching Hospital.
My name is Florence Amah, the welfare chairman for Pharmacy Department Welfare, and also Korle Bu Teaching Hospital Staff Welfare Club, the welfare chairman.
My name is Philip Elikan Pamako, the head of finance at the Pharmacy Department.
My name is Obidia Akwele Senike. I'm a senior specialist in pediatric infectious diseases, and I'm the pharmacist in charge of the child health department.
Hey, my name is Francisca Siga, pharmacist, clinical pharmacist, currently the head of Unit for Statistics Research, Quality and Assurance.
I am Korle Bu Nkansah, the pharmacy administrative manager for Korle Bu Teaching Hospital.
My name is Joshua Sanusi, HR manager for Pharmacy Department.
My name is Annie Anna. I work in surgical pharmacy. I work as an organ.
My name is Dr. Francis Kofi, Chief Pharmacist in charge of the surgical pharmacy, Korle Bu Teaching Hospital.
My name is Dr. Mrs. Dokas Teaching. I'm currently the unit head of the cardio pharmacy of the National Cardiothoracic Center.
I have known Auntie Ama since I came to Korle Bu 2004 when I did my house job. She's been a mother to us. She's been helpful. I was here when she became the director of pharmacy, acting director of pharmacy. And I worked with her at that level. At that level, you could go to her at any time to sort out any problem you had at the unit. And this, I am very grateful for.
I have known Dr. Mrs. Florence Amah Nkansah for the past 6 years. I have worked directly under her when she was Deputy Director of Pharmacy, Clinical, and Acting Director of Pharmacy throughout. I would say my working experience with her, wouldn't say tedious though, but she's very attentive to what goes out from her office to any other office. She's a director that will write or make you write letters 5 times. She will correct the first one, correct the second one, correct the third one, and up to the 5th one before that letter will leave her office to the appropriate quarters that is supposed to go. If she even gets the chance, she will correct the 5th one. And she's, like I say, she's a mother. I will say a mother because my mom is also called Florence. So she being Florence, I took her as a mother who I listened to the direction throughout my working experience with her.
I've been working with Mrs. Nkansah for more than 20 years now. In fact, I first met her when I came to do my internship. That was in, I think, 1997. So it's been 28 years now since I've known her. Yes, and I must say that Mrs. Nkansah is God-fearing. She is very ambitious, and also she is so passionate when it comes to her work, especially anything relating to clinical pharmacy, pushing pharmacy high. She's always there, and she's a good leader. I really enjoyed working with her. And it's rather sad that she's gone on retirement, but I know she has played her role well here and she's left a mark that we can always look at and remember her for her good deeds.
We in the finance department would like to say that Dr. Mrs. Amah Nkansah was not just a director to us, but also a mother who always ensured that due process is followed in carrying out all her duties. I remember vividly, anytime I have to send a memo to her, she will not only ensure that the validity, accuracy, and the legality of the memo is established, but also ensure that the content of the memo is devoid of all grammatical errors before she affirms her signature. And so we in the finance department have actually enjoyed working with her. We cherish her guidance, we cherish her directions, and we want to wish her very well, even as she retires.
I've known Auntie Amah, I think, I came to Korle Bu in December 2002. But proud to come into Korle Bu, I was a TA and was doing my rotation at Korle Bu Teaching Hospital. And that was where I first heard about Auntie Amah, wonderful Auntie Amah, powerful Auntie Amah. I didn't know who she was, but they said, well, she's one of the best pharmacists, female pharmacists in Ghana. Then I didn't know I would be coming to Korle Bu, but I found myself in Korle Bu. And then I met her. Though I haven't worked directly with her, but I'll say she's been a very good mentor. Aside being working professionally, she's also a good friend, a good counselor. She's actually impacted so much, both professionally and then spiritually, and then good friendship. She's one of the pharmacists that I actually looked up to, and I will say that she has been an inspiration that I actually get into doing clinical pharmacist.
The first time I met Auntie Amah, in fact, Auntie Amah, I call it Auntie Amah. I met her as a preceptor, and she really showed me that I didn't know anything. But she didn't belittle me in the way she acted towards me. She brought out the best in me, and that's the Auntie Amah we talk about. Auntie Amah is somebody who is down to earth and brings out the best in you. I read a book that said that strong man is a person who has been belittled, insulted, but still keeps his emotions intact and shows his maturity. That's the Auntie Amah I'm talking about. She's even more than this man. She's helped a lot of us.
I worked with Auntie Amah since 1999. I know her very well in how she is. She is very, very capable. I will use 3 words to describe her. She is capable, she is proactive, and she is very industrious. I enjoy working with her during his tenure as head in surgical pharmacy. He is time conscious and leave late in the evening. He always advised me to be faithful.
I've known Dr. Mrs. Amah Nkansah, our former director of pharmacy, since my first day in Korle Bu, 2003. I worked with her over the years, and in the capacity of the welfare chairman, I recall the day that we were inaugurated. Auntie Amah, as we affectionately call her, made a prophetic statement that Collins, Dominic, this team of welfare executives, if you are unable to perform, then pharmacy department will not have any good welfare executives. And true to her words, and with her prayers, we have been able to excel, and the welfare is in a better position than we found it. Working with Auntie Amah in terms of welfare, I can say that when it comes to welfare activities, Auntie Amah is unparalleled. In that, you will call me often to her office and say, Collins, have you heard that so-and-so has been admitted? Have you visited him? What have you done for this? So-and-so is going for a procedure. So-and-so is bereaved. Very, very commendable. And now that she is out of the scene, Auntie, we will miss you dearly.
It is an honor and a privilege to say some few words about a respected oncology pharmacist and the former acting director of pharmacy, Dr. Amah Nkansah, affectionately known to us as Auntie Amah. Auntie Amah is not just a leader, but a pillar and a trailblazer for oncology pharmacy because she has shaped the profession of oncology pharmacy. In fact, we are currently riding on the successes that she achieved in oncology pharmacy. She helped us in establishing Oncology Pharmacy Association. She helped us in improving or advancing oncology pharmacy knowledge and establishing oncology pharmacy as a specialist practice in pharmacy. And we are so much grateful for the effort she has put in improving our practices. In fact, this is not the end of it, but rather we celebrate the legacy that she has left behind. And we believe that we are going to ride on this legacy now and forever to improve the practice of oncology pharmacy in Ghana.
Auntie Amah, as we affectionately call her, happens to be my superior. I knew her since 1994 when I came to Korle Bu Teaching Hospital to do my housemanship. She is very proactive, prime, and proper. She's scrupulous, eloquent, and is able to communicate her thoughts and her views in a very explicit manner. She is full of energy, vibe, vim, and invigoration in her approach to things. She is a very passionate, hard-working, and purposeful personality. She does not tolerate laziness, laxity, or laissez-faire attitude. She is very disciplined, strict, and purposeful. She is very, very committed to clinical work in the block. She was the one who pioneered surgical pharmacy in the year 2000, and she became an icon in the department of surgery.
Memorable things that I can still in my mind about Auntie Amah is that in Fanti we have a tradition, and that tradition I will use Fanti language to mention it. We have a word called Usamwawa. Usamwawa means if you give birth, your child should bury you. And I remember that when all my parents died, to pay all the expenses that the cost of the funeral for me. And for that matter, I still remember her as the one who have sympathy for mankind. From that time onwards, I still cherish her for what she did.
A memorable experience I can vividly express is one day we went on ward rounds and there was this patient that was critically ill, wasn't having money, but she paid for that patient's medications and eventually the patient got recovered. She has a motherly heart, and with that I purpose in my heart that during my wedding she will be the one to cut my cake, the wedding cake, and she did.
I remember very well because of her policy that made her to pay attention to detail very well. Anytime there's an emergency and you have to cough out some money to solve some immediate problems, you always pre-finance and then get the refund later on because you would not like to circumvent the laws. And so we remember her vividly for all these efforts as a finance department.
When I came to Korle Bu, that was in '97, Mrs. Nkansah took us through the do's and don'ts. And I remember very well one thing that she kept saying, that we should go in fully for our patients because nobody knows where they will find themselves in future. And I took after that, and I must say that there is really pleasure and fulfillment when you go full in for your patients, yes.
My memorable time with Auntie Amah has always been after work, when I know she's about to go home around 4. You go up there and you meet Auntie Amah and she's like, Agatha, you are here, what is wrong? And then we sit and then discuss issues at the unit. And by the time I leave, I have solutions to work with, and I am very grateful.
Auntie Amah has always been instrumental and a mentor, and she is always sharing her knowledge, experience with pharmacists, especially the younger ones. In fact, it was through Auntie Amah that I got an opportunity to advance my studies at the Ghana College of Pharmacists. She encouraged me to undertake higher programs in oncology pharmacy to improve my skills.
My memorable moment with Auntie Amah would be when I first came to the pharmacy department in 2018. A young boy, I miss so in my tie with my trousers and shirts. What she first looked at was on my left finger and said, "Young man, are you married?" I said, "No." "When are you getting married?" I said, "Oh, I'm on the pipeline." And she gave me a very stern warning that this her department, there are so many young girls coming in to study and passing through here. So she wouldn't want any wahala. So I gave her my assurance that she should trust me. Along the line, she played an integral part in my marriage, my wedding. She counseled me and counseled my wife, and here we are today. I think this is one of the most memorable moments I'll have with her for our 6 years relationship here in the pharmacy directorate.
So I quite remember when I walked to pharmacy the first day, she looked at me. In fact, I was scared. I was like, who am I coming to work with? But he made my stay here very loving. I will remember you, Auntie Amah, for your impact and your mentorship. I want to describe Auntie Amah as a mother, a God-fearing person, and a teacher.
So if I have to describe, this time I'll call her Dr. Mrs. Nkansah. In 3 words, I'll say she's a very good mentor. She's a great counselor. And she's someone that actually brings the best out of everyone in every situation. And she's very selfless.
I would say she's a mentor, she's a disciplinarian, and she's a trailblazer. And we thank her for that.
I would say that Mrs. Nkansah is God-fearing. Mrs. Nkansah is ambitious, and she is very strict when it comes to her work. And even as she's come to the end of her service here, it's my prayer for her that the good Lord will continue to use her mightily wherever she finds herself, so that she will continue to impact lives and continue to leave mark even for pharmacists anywhere we find ourselves. Said that anybody who comes in contact with her will never leave her presence the same.
I would say Auntie Amah is a mother, but she cares a lot. She's a disciplinarian, but she will make sure you do the right thing when she's around. And the third person is she's an affable person, and someone who makes you working with her very enjoyable.
Auntie Amah is kind and generous. She's disciplined and pays so much attention to detail.
Meticulous, hardworking, and affable.
Auntie Amah, I want to say, I could. You've run the race, but this is not the end. As you take off into this other sphere of your life, I wish you all the best. Not just the best of health, so that you not have back pain like I do. The best of wealth, so that you not call yourself a civil servant, because now you are no more a civil servant like I do. You'll be one of the multi-million people who have great ideas to push pharmacy to the next phase. Because for us, clinical pharmacy, I'm a clinical pharmacist, and I am a clinical pharmacist today because of Tech and Tiama. Open the horizon, open the new doors, open everywhere, so that when you also retire in the next 2-3 years, we come and join you and walk in your footsteps. And Tiama, but for you teaching me that I didn't know the generic names of drugs those days in 1996, I wouldn't have become one of the best pharmacists. Yes, of course, I'm one of the best pharmacists. Thank you, Auntie Amah. And this is not a goodbye. I'll see you again and again as we meet in the spheres of pharmacy practice. That's all I have to say. Auntie Amah, Mrs. Florence Amah Nkansah, Aiko.
Dr. Mrs. Nkansah and Dr. Raymond Tete were the first 2 pharmacists who initiated clinical pharmacy practice in Korle Bu Teaching Hospital. Mrs. Nkansah had earlier worked and done her national service at the police hospital, where she got the opportunity to work with ACP retired Mrs. Esther Osei, who was a former chief pharmacist of the police hospital. And so she got the chance to work and learn the rudiments of clinical pharmacy practice directly from the one who initiated the practice in Ghana. I remember the enthusiasm and the passion with which Mrs. Nkansah worked when I first entered Korle Bu Teaching Hospital. At the time, training of pharmacists and the efforts that are currently made by the university to give students exposure in real practice was not as developed as it is now. So these two, Mrs. Nkansah and Dr. Raymond Tete, were our only role models. And I remember her for three things: the enthusiasm with which she worked, consistency with which she worked, and the passion, definitely, which drives consistency. And I also remember her for the way she interacted with other healthcare professionals. I remember particularly her interaction with Professor Naida, Prof. Beidu, and Prof. Daku. Definitely something about her practice must have endeared her to these great professionals. And so it came as no surprise when pharmacists got the opportunity to train formally, and Mrs. Nkansah was among the first 5 to be chosen. The others in that 5 were Dr. Raymond Tete, Professor Muhammad Duweja from KNUST, then Mrs. Hazel from the police hospital, and Mr. Robert Eshen, the late Farm Robert Eshen. These were the first 5 to be formally trained in Ghana. And with that training, she was even propelled to do more. Mrs. Nkansah was actively involved in training of both students from all institutions and interns who happened to pass through Korle Bu Teaching Hospital. She will be remembered for monitoring all these people and ensuring that the right things were always done. I cannot talk about Mrs. Nkansah without talking about her involvement with the Ghana College of Pharmacists. She was a faculty board member of Faculty of Clinical Pharmacy and helped in certain questions, examining our residents, ensuring that their higher standards were met. Sometimes she was seen as too harsh because she would not compromise on standards or accept mediocrity in practice. But Mrs. Nkansah surely deserves to be celebrated. Spending over 30 years of one's life in active practice, impacting lives of patients and impacting lives of professionals is no small feat. And so on an occasion like this, I want to just ask God to bless her with every blessing. And I pray that God's graces will be evident in her life, that God will give her every good thing that money cannot buy.